Million more people are now eligible for COVID-19 vaccines in Massachusetts. Here to answer your questions about it is Dr. Rob Duncan, an infectious disease specialist at Lahey Hospital and Medical Center. Thanks for being here.
Nice to see you again.
All right, this new group includes adults age 55 and older, people age 16 and older with at least one medical condition like type 1 diabetes, HIV, substance abuse disorder, being overweight. Does the virus cause the same type of complication for all of them?
I would say pretty much so, yes. I think of it as generally just a greater risk for more severe disease, more risk of getting infected, more risk of getting, sometimes more risk of being hospitalized.
You know, right now, vaccination rollouts really in a race with these new variants of the virus. Massachusetts ranks very high nationally for more contagious mutations from the UK, from Brazil. Are you seeing an impact yet on our state numbers?
I think so. It's a little hard to dissect it out because it's a complex array of factors affecting that. I think that the variants are probably the UK variant, the V117 variant is probably the dominant variant in Massachusetts by now. But we're also seeing this outbreak of another variant that's come from South America, the P1 variant, which was noted first in Brazil, and that's causing some outbreak clusters in Massachusetts, which we're keeping a close eye on.
So wondering how that might factor into this. A friend told us that her 18-year-old daughter had recovered from COVID last fall, but then on Friday she tested positive for a second time. So I want to ask you, how common are cases of reinfection, and what do we know now about natural immunity and how long that might last?
Well, I think there are a couple of questions there. The first is, was she actually reinfected and symptomatic, or was this a factor just being tested again and potentially having leftover virus that's detectable? Let's presume that she was symptomatic. That certainly does happen. It happens in a small number of people, probably a few per thousand, but that can happen. And the immunity probably lasts, we were initially saying 30 to 60 days. They're now saying more like 60 to 90 days. And as we get more information, that estimate will likely go up because a lot of the immunity appears to be pretty robust once you get up to about 9 months after infection.
So then how long should people who've had COVID wait to get vaccinated? I mean, should they wait at all? Does it matter what kind of symptoms or treatments that they had?
Yeah, I think that a lot of that is still yet to be established. There's a good suggestion that if you get vaccinated after having been infected, your immunity is boosted quite significantly, that it can drive up the amount of antibody that you're carrying as much as 1,000-fold in some cases, and that is often enough to override any resistance that there may be from a variant or just loss of natural immunity. There are a few people who've had treatment with monoclonal antibodies while they're in the hospital or to try to keep them out of the hospital. And that antibody can stick around for a few months. So the suggestion is that people who did get those treatments should probably wait about 3 months before getting vaccinated.
All right. Always good to know. Thank you for your insight, Dr. Duncan. As always, we truly appreciate it.
You're welcome. Nice to see you.